It was kind of a freak accident back home when we lived up in Maine. We had just bought a wood stove to put down in the basement, and I had my dad helping me kind of shimmy it down the stairs, and had another couple of people up with a pulley letting it down the stairs, and we were guiding it. And the pulley system let go. It broke. So the wood stove came toppling down the stairs at my dad, and I kind of pushed him out of the way and braced myself, and the wood stove hit me pretty much straight on, and that's when I felt something pop in my back. And right at that moment, I was in pretty extreme pain. I was very active. I played sports actively, soccer and volleyball, so when I was hurt, all of that came to a stop. I was basically left with laying on the couch to alleviate pain, icing, heating, moist heat. You know, I was left with trying to manage my pain in any way that I could, and that pain left me in a state where I wasn't able to do anything physically anymore. I'd been seeing a chiropractor pretty much right along, around once a month or so at that time. So I went to see him, and he looked at it, and he said I could keep coming back for alignments, but because it was a herniated disc, there was really nothing he could do for me long term, only short term as far as giving me a little bit of relief when I went in for the appointments. But the relief only lasted a couple of hours after the appointment, and then it would come straight back. I had sort of written everything off just because I had heard that back surgery at that point was the only direction that you could go in, and because I had heard so many negative feedbacks about back surgery and how it can really make you worse instead of better, I had sort of written a medical cure off at that point. But my wife, always advocating for me, always out there looking on the internet, always talking to doctors, because she was traveling around and talking to this doctor and talking to that doctor. She always was the conduit that kind of kept my mind open to new procedures. But until this procedure, there was really nothing out there that I was willing to try. 10 years later, we moved down here, and my wife gets this great job, and come to find out that they're doing this experimental procedure, and I'd heard about it, and again, I was skeptical because I thought it might be closer to back surgery, which I really didn't want to go in that direction. And when my wife told me more about it, as Dr. Grubbs had done two or three of them, you know, my wife hearing back from those patients and them saying what a great success it was, I at that point said, well, what if I get to lose? I really can't get much worse than I am now, so hopefully things can only get better, and it was a godsend.
The patient had a long history of low back pain with intermittent, what we call radicular symptoms, meaning they had occasional burning, numbness, and tingling going down his left lower extremity. The reason why was the nerve was impinging or pressing on one of his nerve roots, and that was what was causing the pain to sort of shoot down his leg. He had had the symptoms for nearly 10 years, and when he sought us out for treatment, he was 37 years old. He had seen pain management physicians in the past. Mostly what he was receiving at that time was just chronic pain medication to basically mask or suppress the pain the best that he could. He had not chosen to have surgical intervention for his small contained disc herniation, and he was actually a perfect candidate for percutaneous disc decompression.
My wife came home and she was excited and told me, she said, we have a new procedure that we're doing, and it's sort of in its infancy, and it's just becoming a regular procedure now, where we're doing a disc decompression, and it should be able to alleviate a lot of your pain and discomfort. So I jumped on board right away and said, you know, sign me up, you know, as soon as you can get it done, let's do it. And it ended up giving me a second lease on life. I came in, I was under anesthesia for a short amount of time, and when I woke up, it was a large relief compared to what I was feeling before. I'm able to give my son a bath for the first time, bending over the tub. I'm able to pick my son up, you know, when he runs up to me and wants me to pick him up, I'm able to pick him up without any amount of pain. It's really remarkable, and I can't thank Dr. Grubbs enough for giving me this second chance on life.
If you have new onset low back pain, and especially with the radicular symptoms, meaning pain, numbness, or tingling, burning sensations going down your lower extremities, that typically indicates that you have a significant problem, and you should ask your primary care physician to refer you to an interventional radiologist like us here at Sarasota Interventional Radiology for a complete evaluation of your back pain.